Hi, I'm Dr. Hagmeyer, and I want to welcome you to this video series titled Everything You Want to Know About SIBO. Today, we're going to touch on some of the mistakes made on a low FODMAP diet. And if you've been following a low FODMAP diet for any amount of time, you know that it can be very challenging. It can be very restrictive. And because it's restrictive, many mistakes are often made along the way. Diet is an incredibly complex piece of the big picture. And without a doubt, you'll want to work with someone who understands the complexities of this diet. But even if you don't have someone that you're working with right now, these four mistakes may be the little things that you can do and fine tune in order to get your health to the next level and begin to feel better. So this is going to be a super quick video. If you have a more advanced case of IBS and SIBO, make sure you check out the other videos in this series. And so with that being said, let's jump into the four most common mistakes that people make when it comes to diet. Now, reason number one is you're eating a low FODMAP diet at the wrong time of your SIBO treatment. And what I mean by this, eating low FODMAP diets at the wrong time of treatment, is that if you've been eating a low FODMAP diet when you're trying to kill the bacteria or the fungus or fungal overgrowth, it might be counterproductive. Not always, but in some cases. The rationale behind this is that you want the bacteria to be active and you want them to be present. And so the purpose of that is while they're active and while they're present, the antimicrobial and the antifungal, the anti-yeast protocol will work its magic, okay? I know it might seem counterproductive and counterintuitive, but if these foods are feeding the bacteria, the concept of that is that they're going to come out and they're going to play, and it's like throwing a party for them, so that at that point in time you can then introduce those antimicrobials and antifungals and biofilm disruptors, et cetera, and be the most effective with them. All right. Some people, without a doubt, can start out restricting low FODMAP diets right away. They can implement these antimicrobials and biofilm disruptors, and they can see drastic changes. Right. Their gas comes down, bloating improves, diarrhea gets better, constipation gets better, acid reflux gets better, their skin clears up. All of these things improve. Hydrogen and methane levels and the concentration of these levels, they come down, they improve. Some people, especially if they've been on a severely restricted diet for a long period of time, and what I mean by a long period of time, usually 12 months or longer. These are people that have done rounds and rounds of antibiotics. Their guts have been just through the ringer. I find that these people do best if in the initial stages, they focus on correcting many of the different dietary deficiencies that have occurred as a result of being on this restrictive diet. I tend to find that if we focus more on healing the gut in those first 4 to 6 months and not worrying so much about following a low FODMAP diet, these people do better. All right. So reason number one depends on really what a person has done before they come in and see me. Right. I've worked with many patients who have made themselves way worse because the only thing they've ever been doing is making fermented foods and making homemade kombucha and more or less, drinking bone broth day in and day out. All right, this is not the way to fix your gut. Sometimes patients make themselves worse, and sometimes, unfortunately, patients are just in a bad way because of the medications that they've been on for years or currently taking in some cases. I've done another video in the past where I talked about the medications that cause SIBO. All right, so if that's something you haven't seen, that might be something you want to watch as well. Mistake number two about the diet is that your low FODMAP diet needs to be fine-tuned and it needs to be tweaked based on your individual food sensitivities, right? This is where you need to do testing. There's no way around this. This is something that you really just can't guess about. This is not something you can base on how you feel. I can't begin to even tell you how many patients that I've worked with that are surprised when food sensitivity tests come back and they say, geez, Dr. Hagmeyer, I had no idea that I had, reactions to, or I was having an immune reaction to all these foods. So again, something to be aware of. When it comes to food, we've all heard this saying that one man's food is another man's poison. And that just goes to point out that we all have a unique blueprint. We're all biologically different, right? And so that becomes something that's very important. And here's why. We can react to foods from an immune reaction standpoint, and then we can be reacting to foods because we have poor functioning in the mechanics of digestion, right? Most people who go on a low FODMAP diet are eliminating foods because the bacteria in the large intestines have found themselves and migrated up into the small intestines. And now those bacteria are fermenting those foods in the wrong part of the digestive system, right? And that's causing the bloating and the gas, the diarrhea, the constipation, the pain, etc. And this is very different than having food sensitivities or food allergies. A person who has a food sensitivity or food allergy is now having an immune reaction to the foods that we're testing, and we can look for reactions to those foods. We can be looking at IgE reactions or IgA reactions or IgG reactions, all right? So the point here is that the symptoms of a food reaction can often overlap with those symptoms of SIBO. And unless you really test for these things, you really don't know which one is causing the symptoms, the bloating, the belching, the gas, the diarrhea, the IBS. So think about it like this. In the real world, people don't just have SIBO, right? Most patients have SIBO, but they're also reacting to various foods, okay, that show up on the allowable food list, or that green list, so to speak, right? And this is a huge, huge mistake. You could be that perfect patient following a low FODMAP diet to the T. But again, you're reacting to these low FODMAP foods from an immune system standpoint, all right? This is why food sensitivity and even food allergy testing, and even sometimes a stool test, is clinically indicated, all right? This is something I wish more and more doctors and patients understood, because it could potentially save you 12 months, 24 months, 36 months. I can't begin to tell you how long people have been on some of these diets with no improvement and only getting worse. And they were great patients. I mean, they were extremely compliant. So again, don't let that mistake happen to you. So to make a long story short, if you've tested positive for SIBO, the one thing I would really encourage you to do is get a food sensitivity test as well. And the icing on the cake in many cases like this would be even testing like a stool sensitivity panel, all right? So again, those are important parts that I always like to look at when working with a patient that either comes to me, they either have SIBO or we've identified SIBO. Those are three critical tests. All right, mistake number 3 that we see is just plainly, this is just a lack of consistency with the low FODMAP diet. Let's just be honest here. This is a person who's cheating. They're not being consistent with the dietary choices that they should be making. You go to a friend's house and you like what they're eating for dinner, and so you give in and you eat what they're eating. You go to a birthday party and your friend says, "Oh, a little piece of cake isn't going to hurt you," right? Or you go to a friend's house and you're having a few drinks. I think you get the idea here. The point is you cannot do this if you're serious about your health. You have to follow this low FODMAP diet with consistency, and many times with self-control. There's no doubt that this takes self-control. You have to divorce yourself from the mindset that food is pleasure right now. I know we all like to eat. It's pleasurable, it's fun, it raises our serotonin levels and dopamine levels. But the fact of the matter is you're eating for only one purpose and one purpose only right now, and that's fueling your body for cellular repair. That's it. Cellular repair is the key here. So you're not going to respond favorably if you are not consistent with your diet, right? You have to understand just how serious this is. There is absolutely no room for cheating, all right? If you do this for 8 or 10 weeks and you're not feeling any better, I mean, there's no improvement whatsoever, you're still struggling, then obviously there's much more to this big picture, and my recommendations is that you either contact my office or you find someone else who does what I do and will help you identify what these additional pieces are of your big picture, all right? Now, mistake number 4, this is relying on a low FODMAP diet or an elemental diet or an SCD diet to correct the problem. A low FODMAP diet and an elemental diet, or any other diet for that matter, is only one piece of the SIBO big picture puzzle, all right? I'm gonna repeat that again. It's only one piece of the big picture puzzle. It's an adjunct, it's a tool, but the truth be told is you cannot correct SIBO with diet alone. I see too many bloggers out there, health bloggers, and I see too many people in Facebook group, and I see too many articles being written basically just saying you can correct SIBO with diet alone. And I promise you that cannot happen, okay? But I'll also say this, is that you can't get rid of SIBO if you think you're just gonna pop some pills or some medications without making those dietary changes. I promise you, if you do that, I hate to say this, but I promise you, you're going to relapse in 6 to 8 weeks. Okay, people often think that just because they have SIBO, they can follow a low FODMAP diet that they download off the internet, follow it for a month or 2, and then feel better, and then their problem is fixed. Okay, if you're thinking like this, again, I want you to look at this picture here. And what you see here is you see, and I've used this in past videos, the SIBO is really just the tip of the iceberg. This is your diagnosis. And everything you see below the tip, this is your big picture, all right? This is what your doctor needs to look at. Also, your big picture is going to be different than your Facebook friend's big picture, even if you both have that diagnosis of SIBO. Remember, diagnosis tells us what you have, but it doesn't tell us why you have the problem. All right. I suggest you watch some of the other videos in my series, in this video series. Again, everything you want to know. There's a lot of advanced topics in this series that I think you'll find helpful. But the point being here is that SIBO can be very difficult and can be very challenging to get rid of in some cases. Remember that a person with SIBO may also have histamine intolerance. They may have a gluten sensitivity. So that means if you're eating those fermented foods and that kombucha, because you read somewhere that these are gut healing foods and you have a histamine intolerance, you're only making yourself worse. If you have a gluten sensitivity, this is another scenario where there absolutely can be no cheating. In all of these conditions, whether it's histamine intolerance, gluten sensitivity, or even if you're reacting to foods that we call gluten, that are foods that are similar in structure to gluten, we call these gluten cross-reactive foods. Even if you're eating those foods, these foods can still cause all of the same symptoms as SIBO. A leaky gut can cause the same symptoms as SIBO. So consider that if you're following a low FODMAP diet just isn't working like you hoped for and you wished for, then consider these dietary mistakes that people make on a low FODMAP diet as possible culprits, all right? Also consider all these other things that I just mentioned, because there can be just an absolute tremendous overlap in the symptoms, and unless you test, the best you're doing is guessing at all this, okay? So don't be discouraged by this. Just understand that when it comes to food, there are many, many possible scenarios that you or your doctor could be missing, all right? This is where, again, you should work with a doctor who understands the finer points of SIBO, but also work with a functional nutritionist who can help you with meal planning and recipes and all that other good stuff, okay? So that's gonna wrap up today's video. I'm Dr. Hagmeyer, and until I see you next time, take care.